Hi there, health profession students. My name is Sydney Myers, and I'm the program assistant for Utah's Area Health Education Center, also known as Utah AHEC. I'm just going to introduce our program to you and get into our Utah AHEC Scholars Program as well. So about AHECs in general, AHECs were established in 1972 by the federal government in response to the shortage of primary care physicians and inadequate distributions of resources throughout the country. So now nearly every state within the United States has their own AHEC center, and it's really awesome when we get to collaborate across state lines and we get to see how each state's AHEC center is able to respond to their state's unique health needs. Um, a little bit about Utah AHEC. Our executive director is Dr. Yvette Lopez. She hails from Puerto Rico and is working at the University of Utah in the public health program. Her research passions is on health equity in underserved populations, specifically in the Latinx populations. She's very involved in our Utah AHEC Scholars Program. She loves working with our scholars. So if research is something that interests you, I highly recommend reaching out to her and seeing if there's a way you can collaborate. So now about our Utah AHEC Scholars Program. So our Utah AHEC Scholars Program is a free of charge, traditionally 2-year supplemental health education program for health profession students who want to have an interest in underserved urban and rural populations. So I say traditionally 2 years because with the National AHEC program, traditionally the AHEC Scholars is a 2-year course. However, we totally know that each academic program is different, and 2 years is not realistic for some of us out there in the programs we have. We have some programs who go for 5 years. We have some programs that go for 14 months. So it's traditionally 2 years, but if you want to finish before that 2-year time frame, totally fine. If you need more time than the 2 years, again, totally fine. We are completely flexible. We'll give you the time that you need in order to succeed. So don't let that 2 years frighten you. We'll give you the resources you need to be successful within our program. Our Utah AHEC Scholars Program reaches across the state of Utah. We are in several different institutions across the state of Utah, and with that, we are incorporated into many different programs, including occupational therapy assistant program, doctorates in occupational therapy, physician's assistants program, physicians programs, dental programs, radical technology programs. So there is a range to the amount of students we have, and with that, the interests that come with them. So it'd be really irresponsible for me to come on here and say, we have this program, you're going to complete the entrance survey and you're going to do steps A, B, C, and D, and you're going to take the post survey and you're going to go out there and be successful. That's not realistic. You all have your own passions and goals with what you want to do with your health profession career, and we want to honor that. We want to offer diversity. We want to offer things that will supplement each individual health profession student's goals. So with that being said, our curriculum is designed around your academic major and what you want to do with it. If you want to focus on global health, we will give you the resources for that. If you want to focus more on rural Utah, indigenous populations, again, we will help you with that. Maybe you want to work on the policy side of things and work in politics and health administration. Again, we will support you where you want to be. Another thing about the AHEC Scholars Program is it is a nationally recognized program. So after you complete our program and you earn that AHEC Scholar alumni status, you can take that with you as you travel through the United States. And a lot of places will be able to recognize that AHEC Scholar alumni status and be able to recognize the work that you put in order to achieve that title, which is something super unique to some other health profession, other supplemental health education programs throughout the state that are only recognized, unfortunately, within the state of Utah. So if you decide to leave the state of Utah, your work isn't going to be able to be recognized in other states, whereas with the Utah AHEC Scholars Program, it will be recognized. So what's in it for you as Utah AHEC scholars? Like I already mentioned, you're going to receive that national recognition for that program completion. You'll receive a certificate from the National AHEC organization. You'll also receive an honor cord for your program's graduation that you can wear as you walk across the stage and earn your diploma to show your colleagues, your professors, the work that you put in order to be an AHEC scholar. You also receive a letter of recommendation from our executive director, Dr. Yvette Lopez, that you can take with you as you start that career seeking journey. And it's super helpful to have that letter of recommendation to again show the work that you did and be recognized for the efforts that you put into our program. You'll also be able to join a cohort of fellow health profession students from across the state of Utah. As you all already know, health is not a one viewpoint perspective. Health has so many gears working in the background, in the clinical space, within the pharmacy, things like that. And so it's absolutely important that we have an interprofessional view as we go through our health profession. So with the AHEC Scholars Program, we are super proud that we get to offer that interprofessional view as you're still in school and learning about your area of interest and specialty. You'll be able to talk with dental students, with nursing students, with associate in nursing students, with MD students, a whole range of disciplines. So you can get that multidisciplinary viewpoint on health and be able to work across career lines and be just an outstanding multifaceted team player as you start your career. Also, through our Utah AHEC Scholars Program, you'll be able to receive exclusive research funding opportunities. Every year, 4 Utah AHEC scholars receive $10,000 for a research project that betters the communities. It used to be Utah only, Utah specific projects, but recently we've had projects that are focusing in Idaho, in the rural communities in Idaho. And I want to say we also have had some international projects submitted. So again, a whole range of things that you can do with this research. And if research scares you, I'm going to be honest, research terrifies me. Don't let this scare you because we have a team ready to support you through this research project, whether it's through the IRB approval, through the project build up and recruitment, or even if it's for presenting, we have mentors ready for you and there to help you. So don't let research scare you. This is a great opportunity to expand your CV and expand your skill set and focus on a research project that you think will better the community around you. Also, through our Utah AHEC Scholars Program, you'll be connected to a professional mentor. I'll get a little bit more into that in the future slide. So we have 8 core topic areas that we emphasize and focus on with our scholars. You can see them here, but as I've already said, we are not a rigid program. We are not going to force every single one of our scholars to do all of the lessons on all of these topic areas that we have here. Of course, if you're interested in being introduced to every single one of these topic areas, that's totally fine. We'll give you the resources you need to be introduced to all of these core topic areas. On the other hand, maybe you're only interested in behavioral health integration and cultural competency. Again, totally fine. We'll give you the resources you need so you can be an expert within those areas and be an expert in those areas within your health profession. So this slide has a lot. And so before I dive into it, I just want to let you know you are not alone when you are going through this program. You have myself, I am the program assistant. It is my job to support our AHEC scholars. I love my job. I love helping scholars through our program. I love being able to watch you be successful within our program, but also my colleagues are here to help you as well. So you really are not alone when you go through this program. If you have any questions, confusions, you can always reach out to one of us on the Utah AHEC team and we're happy to help you. Another thing to keep in mind is you have 2 years to get all of these done. And again, if you need more than 2 years, we will grant you more time as needed. So don't let that stress you out whatsoever. So first things first, you have to complete your program coursework at your institution. Next, you have to complete 80 hours of clinical practicum. Some good news there is a lot of times with health profession programs is you have to do clinical rotation as part of your academic program. The great news with Utah AHEC is that you can double dip. So anything you do, for example, through your DDS program, you can go ahead and count through the Utah AHEC Scholars Program as well. Of course, if you want additional experiences, additional training, clinical experiences outside of your academic program, you can reach out to us and we can try to place you in an area that interests you. If you are a part of a program that does not have clinical rotations as part of your academic program, totally no worries at all. We will help you either get into a clinical rotation or you can count community engagement hours. We've had MHA students who have done research projects, and the time that they've spent with participant recruitment has been able to count towards the clinical practicum because it was community engagement. Another MHA student was doing health promotion activities with an Indigenous tribe, trying to understand how to better health access in this tribe and working with the population. Absolutely, even though it wasn't completed in a clinical space with a patient right in front of you, totally fine to count that towards these clinical hours as community engagement. So if you have worries about that, if your program doesn't offer a clinical rotation, you can count community engagement hours, or you can reach out to us and we can help place you somewhere, find something that will really interest you and benefit you for your career. Another thing we require is a mentor selection. As I said, one of the perks as joining the AHEC Scholars Program is that you get connected to a professional mentor. Even better, it's a requirement in order to graduate. So if you find yourself being a little shy reaching out to these professionals, no worries at all. You can use us. You can have us help you establish this introduction and establish this network for you. It's really important for us here at Utah AHEC to establish something that'll live beyond our program. We want something you can refer back to years after you've graduated from our program. So with this mentor selection, we're hoping that you can establish a professional network that you can turn to not only your time during as a student, but during your time as a health professional as well. We also have scholars complete 2 community health talks with our team of community health workers. This is a fairly new requirement that we've added after the COVID-19 pandemic, specifically here in Salt Lake City, where we are based. We saw a lot of disparities among our underserved populations. And Dr. Lopez wanted to find out why. Why were these populations being so hard hit by the virus, with little vaccine uptake, not adhering to social distancing law rules and suggestions? Why was this happening? So we talked with community health workers who are individuals from these communities who have a small background, who have a basis of background in health, and they were able to tell us why these multi-generational households within a single family home couldn't social distance because they had so many people within their homes, and having to go to work because you were the main family provider. So if you were sick, you had to just go because otherwise you wouldn't be paid and you wouldn't be able to survive. So from these conversations, we truly learned the value of community health workers, and we are a strong advocate for integrating them into the healthcare team. So with that, we've gathered community health workers, and twice a semester, we gather them together and we talk about a health topic. Previously, we've had pediatric behavioral health, we've had homelessness and the unsheltered population within Utah. So our scholars are able to learn what about these topics from the perspectives of these communities, from a Pacific Islander community, from a Latinx community, from an African refugee community, from a Black community member, Indigenous community members. So you really get to see that full spectrum view again of healthcare and really increase your cultural competency when working with those populations that maybe have a different background and different beliefs than your own. So again, we ask scholars to attend 2 of these events as a requirement, but we offer them twice a semester. So over a traditionally 2-year period, there will be 8 opportunities to achieve this. And we also record them. So if you're not able to watch them live, you have a class during that time, again, no worries. You can watch the recording on our YouTube page and you can get the credit that way as well. We also have scholars attend 2 book club meetings. Every year we select a book This year, it'll be How to Change Everything by Naomi Klein. We freely distribute it to our scholars. Um, Once we receive the books, we send out Canvas announcements, we send out emails saying that the books have been delivered. We can run them to you. We have you guys come pick them up from us. Again, we don't want to be a burden to you guys financially. We understand that it is very expensive to attend school. So we really want to help where we can. So we freely distribute these books during fall semester. And then in spring semester, once again, we gather our scholars together virtually. And we're able to talk about the book. Maybe if you disagreed with it, your perspectives. It really is an insightful conversation that comes from these meetings. And we're just so glad that we can continue to offer them. So over a 2-year period, you'll have 2 opportunities for 2 different books to achieve this. Of course, in the spring semester, we're going to offer many different book club options, different times, different dates to really try to give you a chance to be able to attend one of these live. Of course, if life happens and you're not able to attend it live, there is a makeup opportunity for that as well, so you can still get the credit. We have scholars complete 44 hours of elective credits from our let me restart. Complete 44 hours of elective credits. Now, this can be done through volunteer opportunities, webinars, conferences, if your program does lunch and learns, or if your program has supplemental presentations. I like to tell scholars any activity that increases your understanding or confidence when working with those underserved urban or rural populations can count towards elective credits. Now, with that being said, we also have a Canvas page that is full of modules and trainings that are, again, completely free to our scholars. You don't have to touch Canvas if you don't want to. Of course, I don't recommend that. We send a lot of our messaging and communications through Canvas, but in terms of the modules, we always advise that you look through them, see if there's something that interests you. But if none of them interests you, you don't have to do any of the Canvas modules. On the other hand, we've had scholars complete all of their elective credits primarily through our Canvas modules. So again, very flexible on how to reach this requirement, and you have 2 years to get it done. We also have scholars attend our Utah Primary Care Summit. This is an annual event that happens usually in October. The 2024 event is complete and over. It happened on Friday, October 18th. So if you want to attend a live event, you will have to wait till October 2025. But they're always such amazing events, and I do suggest that you look into it. Utah AHEC scholars get free registration for this event. Of course, if you're not able to attend live, there are makeup credits available. You can watch a past event and submit a makeup credit, and we can get that through that way. So once again, that was so much information, but again, you are not alone when you go through our program, and you have time to get all of these done. And all of these, there is a flexibility in how you can achieve them as well. So like I said, we have a Canvas page. These are just an example, one from each section within our Canvas page of the trainings that we offer, just to show you the diversity we have within our Canvas page. And we try to add to it every single year. Last year, we had students asking for climate change and the effects of health from climate change. So we were able to go through our resources, and we are able to add more specifically to climate change and health. So of course, when you're an AHEC scholar and you go through and you really want something, but it's not there, reach out to us and we'll go through our databases. We'll find something for you. All of these are free for AHEC scholars once again. And again, they are optional, but they are really great resources, and our scholars do love to complete them. So our applications are open. 3 easy steps. You go to our website, utahahec.org, you go to the AHEC Scholars tab, and you hit Apply Now. We have a very few questions asking about your name, email, so we can contact you, but we also ask about some of your perspectives on interprofessional health, as well as some volunteer opportunities. We understand in every single one of the programs that you're in, you had to complete a rigorous application process. We understand that we don't want to tire you out. We don't want to burden you. You are already doing so much. So you don't have to write a 3-page essay for the essay questions. Just a few sentences about your thoughts for the prompt is all that we need. And truly, we hope to see many of you as Utah AHEC scholars. So that's everything I have for you today. If you have any questions, you can reach out to me at sydneymyers@utah.edu. You can also reach out to our Associate Director, Tatiana Allen Webb, who also helps manage the AHEC Scholars Program. And she's very involved in our scholars and loves working with all of our scholars as well. I also suggest that you follow us on Instagram at Utah AHEC Scholars. We post a lot about our programs and our events that we're holding, lunch and learns, community health talks, narrative medicine trainings, and whatnot. But we also post a lot of events from our community partners. A lot of times, community partners will reach out to us with scholarships or their own conferences or their own volunteer opportunities with their organizations, and they ask us to share them with our scholars. So a lot of the things we post are also from the community. Um, that's everything I have. Thank you so much for your time, and I hope to see many of you as Utah AHIC scholars.